Okay, we'll take Q&A for about 20 minutes. And please raise your hands if you have questions or comments. I think we heard excellent selection of studies about different programs, and there's a lot of technical aspects. I also encourage, if you feel like it, the presenters also to ask from each other, but we'll take from the room first. I had one hand there and three hands here. Let's take that first round and then we'll continue.
Hi, thanks for the super interesting presentations. I have two questions actually. One for the first one for Nasir Iqbal. You mentioned in the beginning of your presentation that it was important to understand the role of an asset transfer in a context where a lot of people are receiving also cash support, right? And in your study, this seems to be the setting. But that's true for both treatment and control groups, right, if I understand correctly. So I wanted to ask you, what are your thoughts on how your results could be different if that was not the case? And what is the role of this extra cash support on what you find? And my second question is for the last presenter, for Olivier. I wanted to ask you a little bit about the sort of like your imputation method, just the technical model that creates sort of like estimates the poverty score, and especially because if you're doing an RD, then I imagine that you are really interested in like sort of really the scores around the discontinuity, and if you're imputing them and there's some sort of noise that can sort of perhaps push you to one side or the other. I don't know, I just wanted you to, if you could just tell us a little bit about how that imputation works. Thank you.
Hi, thanks for the great presentations. My questions are for Ashu, which were two. One is in terms of putting your results in context of the literature and long-term follow-ups. There's also intergenerational evidence from Latin America. It's quite long-term since those programs were earlier. From Bolsa Familia this morning, and there's also evidence about intergenerational effects of Progressa, so I would be curious to see how those compare. And then concretely, also motivated by the fact that it's longer-term follow-up, even if attrition is balanced on average, you're showing that there's a positive effect on migration, suggesting that the characteristics of the attrited individuals may be very different in treatment and control if they have attrited for reasons of migration compared to any other reason. So have you compared the baseline characteristics of those followed up and verified that they're also parallel across the arms?
Thank you. Very interesting presentations. These are questions for clarification. I've done a number of unconditional cash transfer schemes, basic income pilots, and done intensive field work in doing that. And one of the things that really has caused a lot of problems methodologically is defining a household. And if you go into a rural area in Africa, we've done it in Namibia, Kenya, or in India, Madhya Pradesh. You find that if you define the household in one way, you get a very different composition and size. If you define it slightly differently, you get a very different outcome. And one of the things is that if you use a usual residence approach, then you get a bigger household, more men, etc. If you use a de facto, this week, then you get a different composition. That's one of the reasons why I oppose a household-based cash transfer. I much prefer an individual. And I noticed that these schemes are all household-based. And a household is endogenous, we all know that. And I wonder if you have looked at the impact on the size and composition of households. That's one level of questions. And it's particularly important in the Pakistan survey because, as I understand it in your description, and it may be that this is a misunderstanding because brevity in your presentation, so excuse me if I'm wrong, But the idea seems to have been you've selected households within communities. Now, actually, in a rural area, as anybody who's spent a lot of time in rural areas knows, households are actually spread. And if you give to one household, depending on number of relatives they have in the village, then they share it on a bigger level or a smaller level. So the concept of a selective targeting is problematic, right? And what we found is that when you do, some people call a saturation cash transfer, where every household and every individual gets the cash, and for the children, they're paid separately to the mother, but separately, then you get quite big multiplier and feedback effects, which you don't get if you take a selective approach. So those are complex issues, but I think it would be very interesting if you, in your presentations and in the follow-up research, could tease out some of those things.
Then on the right-hand side, yes, thanks.
Thank you. My question is for Ashu. I thought you had some really interesting findings, especially considering that the cash transfer is only $8 per month. So often we talk about adequacy of benefits and we don't always find something immediately, but since you've looked over the long term, it looks like maybe the consistency over the years is something that really helps in changing different outcomes. And one of the outcomes that changed was obviously personality. And I wanted to ask you if you, because the other ones are a little bit easier for me to think about the mechanisms behind that, but the personality outcomes, do you have any thoughts about what some of the mechanisms could be that change these personality outcomes? That was...
Okay, thank you very much for the good questions. Let's take a round of responses now. I also personally felt that while the presentations were excellent and very detailed in the methodologies, but as a policymaker, I felt that some of the key policy choices were not so much discussed. You know, they were unconditional and conditional. There were cash plus assets. Was there some cash plus? How about public works? And the targeting, was it proxy means or what? Based on a social registry or based on what? And also, you know, what is the context? Is the political context highly sort of contested, where the election's coming or not? And, you know, those kinds of things would interest me. So if you, in your replies, can bring some of these kinds of aspects also. But we had questions in the order. First to Nasir.
Thank you so much. There are a couple of questions. First, that if the program basically is built on the existing UCT, what we assume and what we found that the relatively larger impact when we compared with the similar studies conducted in other part of the world and then with the same time duration. Probably that was the one of the key assumption underlying this study, and we find relatively larger impact. In the next round, as I said, we just completed a survey where we try to add another layer where there is no UCT to that additional control group. Probably with that result, we would have a better sense that what are the added advantage in terms of a long-term UCT and the long-term UCT, as well as some kind of like engagement with the state, because if there is no program, you are not engaged with the state. But if there is any kind of program, you are engaged with the state, you feel entitled and you feel empowered in terms of making other decisions. The second question is very important in terms of making a decision, who would be the beneficiary. As you mentioned that the household versus families are totally different, especially in the rural setting. Yes, in our case, the targeting was based on the household level. Like when we have to define the eligibility criteria, there was no alternative to come up with the beta family, where we can actually interview nuclear families because there is like a joint family system over there. So the targeting was based on the household level, but when come to the stipend, come to the transfer, it's based at the family level. If, for example, if there are 3 families within the same house, and the household, if eligible, all 3 families would get the benefit. So yes, the another component that you just mentioned, that the selectivity versus the universal. As long as the UCT is concerned, everyone would get the benefit if the score is below the threshold level. Whatever the government is decided for the program, everyone would get the benefit. But in case of this asset transfer, they were interviewed and they were rescored depending upon the potential to graduate. So this is an additional layer. Probably, as you mentioned, that it would have a different implication. If it is for everyone, it would have a different impact. And if it is for a selective people, it would have a different impact. Same thing when we go into the field and we interviewed individually, there is some sort of neighborhood effect that if I'm getting the benefit with the same poverty score and the neighborhood is not getting the benefit with the same score, like they are slightly above the cutoff. So there are a lot of like resentment among these, and we definitely look into these things in the next round. Yes.
Okay. Thanks for the question. So it's a bit technical, but the trick is that in general, you observe only what the household consume. So you observe household angle curves, basically. In fact, underlying that, you have, they are the sum of individual angle curve weighted by each member's resource share. So it's very hard unless you make extra assumption. But in the case of clothing, you observe women's clothing as, it's only one good. And so it's only their resource share time their budget share on clothing. So in this way, you can recover their plus one extra assumption, you can recover their individual angle curve and their resource share. And resource share has a structure, and within the structure, you can put the form of the regression discontinuity design. In this case, it's just the eligibility dummy. It's ITT, it's not whether they receive it, it's whether they're eligible for it. And you put the rest of the structure as a normal RDD within this structure.
Let me start with Daphne's question first, the last one, which is the mechanism. So there are pretty strong effects in the initial RCT on caregiver stress, caregiver quality of life, subjective well-being, and obviously there are huge impacts financially on the household. So those are all things that contribute to sort of the environment in which the child is growing up, right? Which would, according to the psychologist, contribute to their personality development. So that would be the mechanism for that, right? For Jessica, I think, so there are a couple of questions. I didn't quite get the attrition one, but we did, first of all, we're tracking, so we're not only, so we tracked households and we also tracked like youth when they moved out. We compare, I may have to follow up privately on your question. I didn't quite understand it, but in any case, we're comparing baseline characteristics of people that we found and that we didn't find, right? So, but maybe I'll follow up with you later. So the other question is on these long-term follow-ups. So I would say that the only directly comparable study is the Nicaragua RPS study done by Malucho, because that is the 10-year follow-up of the actual original RCT, whereas the other long-term estimates are really kind of more inferential, right? They're based on looking at households that were, and kids who grew up in the area where the program rolled out, right? They're not directly identifying eligible, kids or households. So the design is quite different. Having said that, the Nicaragua study does show impacts on schooling and work, which we don't have in Malawi, for example. I don't think they have health impacts, but yeah, it's a good question.
Thank you, Ashu. There was no question to one of them, so let me ask you one. your conclusions were quite drastic, I would say. You said that the poor card failed to increase consumption. So what political conclusions are being drawn in Thailand now? What is the government doing with the poor card? And obviously you were referring to the targeting errors. They were quite large. And what do you think that could be done to correct the targeting errors? The errors were almost in the sort of Stephen Kidd range, where he's saying that you most often fail on the targeting.
Yep. I think because the state welfare card cover about 15 million people in the country, so the new government they try to continue because of the political reason. Last year we have an election in Thailand, and each party was bidding to increase the value of the welfare to be transferred to the card. So now I think it will be continue because to cancel it or to reduce the number of the recipient may have a political consequences for the party. About the targeting, I think what concerns me most is that according to the survey, about 50% of the poor are not actually get the card. So we want to know the poor by their name. We want to reach out to the poor, but it do not really happen. I think more effort are needed. At the moment, the Ministry of Interior of Thailand, they have a project in order to find the poor, making an effort, but it's covered just about 20% of people in the province, because it takes a lot of money in order to do the big survey or something like that. So, but I think the only way that we can improve the coverage of the program is to find the poor and increase the resources for them.
Okay, thank you very much. The clocks here says that we still have 2 minutes and 13 seconds, but I think we have a bit more because I don't need to speak much at the end. So we can still have a round of 2, maybe 3 questions. Pia and Pia's neighbor.
Yeah, Pia, UNU-WIDER. Very interesting presentations, everybody. I'm going to push the policymaker perspective even a bit further. So there's this very interesting website and initiative around Hendren about the most valuable public fund methodology that you might have seen, where they literally try in the long run to basically how much bang do you get out of a buck using the experimental methods, but like really going forward. So not just showing the impact on day one or after a year, and even going beyond then after the 15 years, but then really making the case for how much actually did the government get back in terms of tax money of people who now have better education. And I'm wondering for the colleagues with the experimental methods here, and maybe also particular to Ashu with the long run perspective, I realize there's many dimensions to such policies, but I think at least in 2 or 3 policy dimensions, I think all these studies would have something really interesting to tell. So I'm wondering if you're considering something like that.
Thank you very much for the presentations. I have a question for Olivier. I thought it would be interesting to see if the effect on children is different depending on gender of a child. I was just wondering if you tried to look at it.
There's one more here.
Hi, I'm Emma. Thank you very much for the great presentations today. I have a question regarding the delivery methods of the benefits, and I want to ask if you have seen in your studies any effect on long-term outcomes differentiated between cash and digital delivery. I'm thinking about Malawi more specifically because I think that around 2018 or 2020 they have transitioned from cash delivery to digital delivery. So I really want to understand if you have looked at that and if you've seen like additional benefits. I'm thinking about, for example, financial inclusion, access to credit, etc. Thank you.
Okay, so there were clearly questions to Ashu and Olivier. So maybe Ashu, if you start.
The bang for the buck is a great idea. I think we're still in the midst of like figuring out what all the impacts are with the data, and I think once we have gotten a good sense, then we would move to something like that. I think that's a great suggestion. On the Malawi payments, first of all, the move to digital is not national; it's in selected districts, and basically what's happening is that individuals are still immediately, like they get a card, and they get the card loaded, and they immediately go and cash that out. So they immediately go for the cash. But having said that, the village savings and loans groups are quite successful. So we do see much more savings and participation in the village and savings loans group. But those don't have anything to do with the card. They just have to do with the fact that people have cash and those groups are now active. And so it's like a vehicle for them to save.
Thanks for the question. There's a huge literature on pro-boy discrimination and child gender imbalances, not only on selective abortion and so on, but also in the realm of consumption, starting with Deaton, who are using like early version of this kind of things with consumption data. In our case, I don't think we find any difference between men and women, which is between boys and girls, which is not so surprising for Uruguay. But I will double check. I don't think we report it here, so I will check. Thanks a lot.
Okay. To be fair, I think I would now like to encourage if Nasir or Wanafong, if you want either to ask something from the rest of the panel or raise something.
Yeah, thank you so much. I just review the Asha's paper. Is mainly when I was developing this study, and also I did some work on the unconditional cash transfer. My main concern is how we can control different kind of spillover effect, and especially the question that you just asked at the very opening of your remarks, that the R program basically built on existing infrastructure of the UCT, and what happened if this kind of infrastructure is not there, and how the program behave differently, and what would be the cost of this entire setup? And maybe the other two panelists would have a much larger experience from other countries, how the different program would behave differently when there is no infrastructure. And the last is what happened when the state capacity is weak, because the scalability is always remain a question. Our city is good enough, but whenever we talk about the scalability, is always remain under question.
I think for the case of Thailand State Welfare Card, the next thing that I want to do is to look at how and why it doesn't work. And actually, there's no that much resources for me, because I think the majority of the published work is that you found a positive and also long-term impact of the cash transfer in Africa, in Latin America, Indonesia, and everywhere. But for the case of Thailand, there's no impact. So I just would like to. It would be great if you can suggest how we can look at the mechanism that can explain the no effect. Yep. Thank you very much.
Okay, is there something very, very burning? No. So I'd like to thank the panelists for an excellent panel, and I would encourage you also to interact still among yourselves, maybe on the more methodological questions and the choices. I think I would only wish you all long and healthy lives. I'd love to see Ashu's 25-year impact studies and maybe 35 years. I hope I'll be healthy listening to your presentations then, and all of us. So thank you so much. I'm not one of the organizers, but if I understand correctly, there's a dinner at 8:30. Is that correct? And I mean 6:30, and it's not here. It's about 400 meters away. So maybe would someone from the organizers want to give the guidance?
The dinner starts at 6:30 in the restaurant Toppa.
Do we all know how to find it?
Okay, for those invited to the dinner, if we can walk together, so 10 minutes after 6 we can meet at the entrance.
Okay, yeah, and sorry if I remember correctly now, I think the dinner was for the presenters only, and thank you for everyone for participating. Sorry if someone feels excluded now. That's you had your treat yesterday. So I wish you all a good continuation of the conference and beyond. Thank you so much.